You're miserable. You've got a fever. My name is Beverly Bitterman, ARNP, Health and Wellness Consultant, and I'm here to talk a little bit about how you can bring the fever down. One of the first things to consider when you've got a fever is fluids. You want to make sure that you're getting plenty of water. That's at least a minimum of 1 ounce of water for every 2 pounds that you weigh a day. You can drink it in plain water format. You can drink an electrolyte solution. You could drink a diluted juice. Anything that gets fluids into your body is good when you have a fever. Secondly, it's important to know how high is your fever. Fevers actually work for you. They help your body create an environment where bacteria and viruses don't like to grow. So personally, for myself and my children and my patients, I recommend not doing anything if you can help it if your fever is 102 degrees or less, other than, of course, the water. But if your fever is higher than that, or if you're just too uncomfortable, then here are a couple other strategies. One is a cool, or what we call tepid bath. And you can do this for yourself or your child. Just have the water be kind of lukewarm, less warm than they are, and have them sit in the bathtub and just relax in there or play. That will help bring the fever down. The next thing you can do is to take over-the-counter, we call them antipyretics. These are things like Tylenol, Motrin, and aspirin. Of course, you don't ever want to give a child under 16 years old aspirin because it can cause Reye's syndrome, which can result in death. You can use Tylenol, you can use Motrin, and you can alternate them. So you could give Tylenol at 2 o'clock and Motrin at 4 o'clock if the fever is still high and you can't bring it down. However, if you have a fever that's over 102 and it's staying over 102 for your child or yourself, and it's lasting more than a day or so, and you don't think it's the flu or something that you know for sure what you're dealing with, I'd advise you to call your doctor or your pediatrician and get their advice on what you ought to be doing. So we've talked about liquids, we've talked about baths, and we've talked about analgesics. My name is Beverly Bitterman, ARNP, and I hope that you feel better sooner than later.